Hello, and welcome to Hikigai AI podcast, where we explore the intersection of healthcare, technology, and innovation. Today, I'm thrilled to be joined by Fateme Taghinia, founder and CTPO of Searchio AI and Recovery Assist, who's been at the forefront of patient centered AI solutions. At Hikigai AI, we are also passionate about building AI scribe and predictive tools that make healthcare more patient centric. So, hi Fatime, how are you?
Hi, Palak. I'm fine, thank you, and hi to your audience.
Great. So, let's start with the big picture. Can you share briefly the vision behind your startup, Recovery Assist?
Yes, of course. Well, with Recovery Assist, I aim to provide my ambitious goal is to provide the best class recovery assistant 24/7 for every patient, even for the remotest areas. And to achieve that, I want to utilize all the power that I have, all the technical power and expertise that I have. I want to make sure that when creating a recovery plan for each patient, we have to make sure that their underlying disease factors are taken into account. And on the other hand, I want to make sure that I will provide accurate and transparent information for the medical staff to create a tailor-made decision for that patient. And this way, I also can reduce the workload on the technical staff. In general, I would say I want to create a better user experience for both parties, patients and technical and medical staffs. And if you ever have been in a hospital, I think you understand what I mean.
Totally, totally. So, you have an AI tool that helps clinicians and patients both. So, that must be very challenging. And speaking of challenges, what is more hard, building an AI product or a technology that is excellent, or building trust of clinicians who are going to use it?
Yeah, I would say with confidence the second one. So I can create very noble AI-based solutions by myself, but at the end, the aim is to build solutions that are being used. And of course, gaining the trust with clinicians is the most crucial part. And I want to build something that they will champion for it and they will use it out of the box. And to gain this trust, I think I have to start with building something with low cognitive loads that they will feel easy to operate with. At the same time, the more you can showcase that you are in compliance with the ISO 27001, Data Privacy and Security, AI Act, and so on, you can build this trust easier.
Mhm. I mean, that's a brilliant perspective. But do you think that co designing with the clinician from the start can actually accelerate this process of trust?
Of course. Well, I believe that at the end, clinicians are either my entry point to onboard the patients, or they may even be my partners. So I want to make sure that it would be easy to onboard them. And I think by co-designing my system and my product with them, I can get their feedbacks early on and incorporate that into my product.
Excellent. Do you have some story where a minor tweak in your product could help a clinician actually adopt the product better, which they were initially resisting?
Yeah, well, let's say, first of all, the main or most common response when you reach out to clinicians is resistance because, first of all, they have been approached by other people or other organizations in the past promising the same thing. And later on, that product proved either incomplete or wrong. The other thing is that if you don't speak their languages, you cannot gain their trust, you cannot get their attention to go to the point that you can actually present your product. So I would suggest first of all, have some research and make sure that you speak their languages, get your terminology aligned, and then start the have the elevator pitch with the kind of most important key advantages that your product can provide. And the other thing, very important thing, is about having your measurable KPIs, those KPIs that they can understand, they can resonate and relate to it. And based on these factors, you can, well, kind of let that resistance go, you know.
Yeah. So when you said speaking their language, so I think doctors are already learning AI. So maybe it's time engineers learned a little medicine. Yeah.
Yes, of
Yeah.
course.
So let's say that we have now gained the trust of clinicians. How do you make sure that clinicians actually use the product, especially if they are not very tech savvy?
Yeah, first of all, I highly recommend that you start with those clinicians that are tech savvy, because they already have IT department, they already know about these interactions. They have some people dedicated to this area, and it is great if you start your pilot project with them. But at the end, you want to build something that every clinician could use them, right? And to make sure that you can convince them, as I said, have your KPIs already sorted out, that you can get their attention, build something with low cognitive load that they can use immediately, build something integratable with their already existing dashboard. You don't want to build something extra that they may never use, right?
Yeah.
And build something which is self-explanatory and also intuitive enough that the usage would be easy. And other things like give them options for opt out or override the decisions.
Mhm.
And the very important thing is about being able to answer their data security officers' questions, which is really a concern for them.
Yeah.
And yeah, by doing all of this, I think you can gain the trust in all the clinicians and make a better network.
Okay, so that's actually smart because clinicians these days are burdened with so much data that it's adding so much to their cognitive load. But what they actually need is insight that could make their workload easier. Speaking of clinicians, do you come around some of the misconceptions that clinicians have with regards to AI tools?
Yes, I wouldn't call it misconception because it's somehow true, you know. It's like most of the clinicians, they believe that AI is incomplete or unable to learn or adjust, which is kind of true if you don't retrain your model or if you don't fine tune your model based on their feedback, then that is correct, right?
Yeah.
So the other thing is about hallucination, and we all know that AI hallucinates. But the way that you use AI and the way that you create your solution, that you can avoid that hallucination and make sure that you have some factors like validity of the result, confidence factor, transparency of the resources. This way you can make sure that they understand that your AI or your solution is reliable, because this is not just AI getting some information, creating some random responses.
Mhm. I think a lot of clinicians are going to relate to what you just said. So that also builds my next question. Um, I recently read in an article that digitization of healthcare in Germany started quite late than many other developed countries. What do you think is causing the slow pace of digital transformation?
Well, I can see multiple factors playing role there. First of all, if you compare Germany to Britain, NHS has already a clear guidance for startups how to go to this market. But in Germany, this should be adopted and is still in earlier stage. I can tell you multiple factors, like first of all, the language barrier that kind of scares the migrant
Yeah.
founders, because they see all the documentations are in German, and even Gematik, which is kind of a integrator between all the healthcare systems. It's their documentations are mostly in German.
Mhm.
The other thing is about the pale presence of startup hubs in this sector. I really couldn't find something really strong and well established. And main thing I would say is missing clear regulatory options for the startups. Uh, I'm coming from payment background, and there, well, of course, you have licenses for banks, PSPs, and so on. But with PSD1 and PSD2, startups could provide added value services in this industry. And here in health tech and healthcare industry, I would say with the presence of DIGA, which is recently developed for startups, this is going to be changed, but we are still in the beginning of this path. The other thing that I face personally, because I am integrating right now with some of the services, is the lack of sandboxes. Because as a developer, you want to make sure that your service is working well, and you want to test it based on, of course, test the data, but real environment before going to the market. And in this industry, I unfortunately haven't found the sandboxes that regulatory could provide, and it could give me the opportunity to test my product in advance.
Mhm. So, if I understand you correctly, so it's not just the regulation themselves, but also lack of testing environments and resources that are also slowing the startups down.
Exactly.
So, it must be quite challenging. And speaking of challenges, in your startup journey, uh, have you come across some friction points that you encountered?
Of course. That's the startup life.
And you
So,
living in Germany and the language barrier, I think everyone has it. So I think that would be also one of the friction points, I guess. Yeah.
yeah, yeah. Apart from that, I also had this problem that sometimes I presented my ideas to some ambassadors from VCs or startup hubs, and they didn't get the idea. So my advice to VCs and investors is that please make sure that your ambassadors are onboarded into the latest technology. My advice for entrepreneurs is that don't get cold feet when you are facing this situation, that you are getting cold feedback.
Mhm.
So if you believe in your idea, have something demoable, because demos are most probably understandable, right? Rather than talking about the features. And
Yeah.
also move on, go find another hubs and present for them. Hopefully, they will get your idea, or they will have interest in that idea in that particular time. Apart from that, of course, regulatory is there, and in the beginning, you want to face less regulations. So I try to start with the features who are less regulated. And the other thing that I was thinking is about data conversion, and I should not underestimate the data conversion and integration load, because at the end you are part of this ecosystem, and you want to make sure that your software is built in a way that it can be easily integrable.
Mhm.
And the other challenge is about revenue model in general in health care and health tech industry. Unfortunately, the number of cost centers that you can reimburse, your service costs based on that are kind of missing in the insurance policies. With DIGAs, it's getting better, but still in the beginning.
Yeah. So I think this is going to serve as 101 motivation for the new founders, and it's like really important for them. to not forget, to not lose hope. Building on that, I'm curious. Do you think that cultural adoption and resistance to change is also like one of the bigger problems for a startup to actually, take place?
Yeah, yeah. I think regulatory and cultural adoption, they are kind of hand to hand. Well, people are used to the systems that they already have been working with them for quite a while, right? So why do they need to change? But I think with the new development in AI that is kind of present in everyday routine for each person. So can you name somebody around you that they didn't use ChatGPT, Perplexity, or any other AI-based tools? No, of course. So the clinicians and the medical staff are also using that. So I would say this pattern is changing. So this adoption is already being happening, right? Is already happening. And I think with some ease from a regulation side, there would be a lot of innovation in this sector.
We can always hope for the best. Um, so, our conversation has been around like in the present and what has been like it before. But what do you think about the future of healthcare? Do you see AI evolving over the next 5 years in more decisive roles, or you think it will still remain assistive like it is now?
Yeah. I think based on the current situation, it will still mostly assistive, and well, maybe in some low risk areas there would be some decisive AI systems like, I don't know, scheduling, population screening, these kind of areas which are kind of with lower risks. But in
Yeah.
general, I think we would need a kind of a clinician's supervision for AI-based solutions. And well, maybe it's not for, maybe it's for a better good that we make sure that there is a person involved there. And I think for the early future, I can see AI will stay assistive.
I like how you frame that AI taking on low risk while clinicians retain the control, and I somehow also feel like it should stay that way. Um, well, speaking of patients, do you feel like how clinicians are helping in co designing AI tools now? Could patients play a vital role in co designing AI healthcare solutions as well?
Yes, of course. Well, actually, I am an advocate of concept of product discovery. Whenever I am working in the software development industry, I am saying, or I am telling people that we need to make sure that a part of the discovery is incorporated feedback from the end user, and patients are definitely our end users, so we want to make sure that their requirement has been already incorporated into our products. For example, I was thinking about a feature, and that feature includes a speech to text feature or service. And I was thinking, okay, with German dialect, how would it be possible with the already existing model? Should we fine tune the model, or is there any other solution? So I would say know your customers and make sure that you get some feedback early on about their pain and their requirement.
Like so you I when you talk about like voice to sorry, text to voice, do you feel that dialect and languages are also like posing problems?
Yeah, 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 of course. Well, my case was speech to text because, well, German dialect can really vary, and maybe your AI model is not trained on that. But yeah, of course, that's one of the features that you have to think in advance about that.
Okay, that's interesting and quite fascinating. So, for our listeners, consider this: if you are a healthcare professional, how could AI tools like Recovery Assist make your workflow easier? And for tech founders, which clinician pain points could you solve next? Fatime, thank you so much for joining us and sharing such candid insights. Today's conversation was really engaging and I totally enjoyed it. And it also shows how context driven AI matters and how it can help clinicians so much. And to our listeners, thank you for joining in. And if you enjoyed this episode, share it with your network, subscribe to Hikigai AI podcast for more discussions like these. And until next time, keep building AI solutions that truly make a difference.